Hey everybody, and welcome back to my PTCB online study resource. This is going to be part 2, routes of administration and dosage forms. Alright, let's go ahead and get started. Alright, so we're going to go ahead and get started with enteral administration. This refers to drugs that are absorbed within the GI tract. Certain drugs that would fit this category is going to be oral route medications such as tablets, capsules, syrups, elixirs, suspensions, buccal, and sublingual. And just to give you a little reference on what buccal and sublingual means, buccal is going to be drugs that are dissolved between the gums and the cheek, and sublingual refers to the dissolving of medication beneath the tongue. Tablets may also have a special coating surrounding them, and that's just to protect them once they're ingested. The GI tract, the stomach itself, has a lot of gastric juices that are pretty powerful, and so some of the medication can actually be broken down. That eccentric coat just basically allows for it to travel through the stomach and hit the small intestines where it's properly dissolved. And tablets can also be dissolved just by itself in the mouth, so you put it in the mouth, it's dissolved, and you swallow it. These are primarily good for younger populations, extremely old populations that may have trouble swallowing, and individuals that might be vomiting or might be experiencing certain convulsions. Alright, now we're going to talk about some of the liquids. So solutions are liquids where the solution, the drug itself, is completely dissolved in the solvent. Suspensions are kind of like solutions, except that they are not mixed all the way, so you have to shake those prior to use. And then elixirs are solutions that are dissolved in a solvent in a varying degree of alcohol. And those usually range from about 5% alcohol to 40% alcohol. Alright, we'll talk about ophthalmic administration. This is going to refer to medication intended for the eye. These can be used both in the eyes and the ears, and I'll go into further detail in the next slide why that's important. But these can have many forms: drops, suspensions, ointments, gels. And the main difference between gels and ointments is that gels they basically liquefy when they come in contact with the skin, and they leave kind of like a film of the medication itself, and that's going to be actively dissolved. Whereas ointments are going to be placed inside the eye. You'll actually pull down your eye and place it on the inside lower portion of your eye, and they will stay kind of in a solid form, but they'll melt down, and that's where the medication's going to last right up in the bottom of your eye, and it'll work over a little while for it to dissolve into the eye itself. Alright, now we'll talk about otic administration. This is going to refer to eardrops, and like I said in the previous slide, ophthalmic drops can be used in both the ears and the eyes. Eardrops or otic administration drops are only for the ears. They cannot be substituted for eyes. So eardrops are for ears, eye drops are for eyes and ears. Alright, next we'll talk about inhalation administration. This is going to be referred to drugs that are inhaled either through the mouth or the nose, and they include inhalers. They are handheld devices. Majority of you guys should know what an inhaler is, or at least have seen one. But they're handheld devices that offer the exact amount of medication to be delivered once actuated. That just basically means once you press down on it. If it's a little can, you'll squeeze the top of it a little bit with the inhaler itself, and it's going to dispense a burst of air. Or it could be a pill that once you inhale it, the little particles, when it's broken, will go down into your lungs. The other form of this is going to be nebulizers. Nebulizers are a machine that convert an ampule of drug, which is just a vial of medication, into a fine mist that's inhaled over a duration of time. So usually a nebulizer session will last about 5 to 10 minutes. Alright, next we're going to be talking about parenteral administration. This is going to refer to injections. And there are many types of injections, but the main that you need to focus on for pharmacy or hospital as a technician is going to be subcutaneous, intramuscular, intravenous, and then intradermal. So subcutaneous just basically means it's injected into the subcutis, which is below the epidermis and the dermis layer of the skin. Intramuscular is going to be injected directly into a muscle. Intravenous is injected into a vein through an IV. And intradermal just means it's injected into the dermis, so it's slightly higher than the subcutaneous injection. Alright, topical administration. This is going to refer to medications that are applied to the exposed skin. Medications include creams, gels, lotions, ointments, transdermal patches, and powders. Powders are used in like foot fungus and different types of fungal infections. And transdermal patches are used, they basically just stick to the skin. There's certain specific sites that you want to apply them to, and most of the time they are supplied on the box or a little packet insert, and they'll explain how to properly use and dispose of these. But they just go over a portion of the skin, and they work by delivering a specific dose of medication into the skin, and it's then absorbed into the bloodstream. Alright, and then we've got suppository administration. This is just going to refer to drugs that are administered either through the rectal route or by vaginal route. And they are activated after they are inserted, they melt and dissolve, and that's when the medication itself is released. And these are very important for individuals who can't swallow, if the individual is potentially vomiting, and sometimes forms of medication dissolve too fast and are broken down by gastric juices, so it's actually a little bit better to just do the suppository route than taking the pill by mouth. So that's going to wrap up today's video. I hope you guys enjoyed. I am trying to fire out these videos day after day. They do take a little while to create. But if you guys are enjoying the content, feel free to leave a like and subscribe to my channel. And I'm trying my best to get as much of this information out to you guys so that you can use it as a auditory and a visual representation of what you need to know for the PTCB. Alright, thank you guys once again.